Hi, I'm Dr. Jeff McConnell. I'm an acupuncture physician, licensed massage therapist, and Reiki master. I have a clinic in St. Pete, and today I'd like to talk to you about energy medicine. My interest in energy precedes my interest in energy medicine. So throughout the course of my life, I've been interested in martial arts. I've attended, I believe it's 10 schools of martial arts with many different cultures, the Japanese cultures, Korean, Chinese, and Thai cultures. And while each of these different martial arts had different theories and techniques, one thing that they did share in common was the concept of that we have energy that we can use in a martial art way to make us more powerful and effective. So for example, if I'm a 150-pound martial artist and I'm facing 3 large men, I'm going to be at a disadvantage because I only have so much strength that a 150-pound body can generate. But the amount of energy that I can generate and move is theoretically unlimited. And that really appealed to me. I remember one time when I was stationed in Korea and I was taking a Kung Fu class. And I remember one day my instructor said, "Hey, you want to feel the difference between being hit by a regular fist and being hit with energy?" And I'm like, yeah, that sounds great. Which even though I knew I was going to get hit, I wanted to learn this. So I said, okay, great. So he had my friend punch me in the stomach, my friend Watts. And he didn't hit me that hard. And my instructor says, "No, I want you to really hit him hard." And I go, no, that's okay. And he goes, no, you'll be fine. Just do your breathing techniques. You'll be okay. So I said, okay. So I got down to my horse stance and my friend just nails me really hard in the stomach. And back then I was in pretty good shape, so I had a six-pack and I pulled out my t-shirt and there's the outline of Watts's fist on my abdomen. So he hit me pretty hard, but it mainly just hurt my abdominal muscles. And it wasn't hard enough to disable me, it just hurt a little bit. So then after I rested for a little bit, my instructor says, "Now I want you to feel what it's like to be hit by energy." I said, all right. So when he hit me, it didn't hurt the outside of my body hardly at all. My muscles didn't really feel much, but inside it made a difference. It made me drop to one knee. It felt like the trap door on the bottom of my body just opened up and everything dropped, because he extended some of his chi into me as the strike. So that got my interest, like, man, energy is really powerful. So fast forward many years later, I decided to go to massage school. My interest in learning massage for a career was secondary to my interest in learning shiatsu, which is the finger version of acupuncture. Same theory, same pathways, same points, but you use your finger instead of a needle. And I figured if I could learn the theories of where the chi flows to the body, I'd be way better at martial arts. And then secondarily to that, I'd have a career. So that's got my interest in energy even more. So once I went to school, I learned shiatsu, then I learned Reiki, then I eventually went to school and learned acupuncture. And as I went through each of these stages of learning more about how to manipulate the body's energy, I started getting more of an idea of what energy medicine really is. So the ancient cultures, especially in China and India, they both understood that everything is energy. Everything is vibrating as energy. The Chinese would call it qi, the Indians would call it prana, but it's the same stuff. And they realized this. Well, modern physicists like Einstein came up with E equals mc squared. Energy is equal to the mass of something times the speed of light squared, 186,000 miles per second times 186,000 miles per second. So that same 150-pound body times that is a tremendous amount of energy. So when people say, "I don't have enough energy," I get the idea, but we have energy. It's just, it could be blocked, it could be imbalanced, it could be not properly smoothly flowing, and those are all issues. But we have energy. So when somebody comes into my clinic, I like to try and observe them from 3 perspectives if I can. The first perspective is the slowest perspective, the slowest vibration. So for example, ice, water, and steam are all H2O. They're just at different vibrational speeds. At the physical body, like the ice, we're solid. We have joints, we have bones, we have nerves, we have muscles, we have trigger points, we have fascia. We have digestive organs. This is a physical reality. If at that level there's a muscular imbalance or a tight fascia or trigger points leading to problems, that needs to be addressed at that physical level. Because if they don't biomechanically move smoothly through gravity, they're going to use more energy, they're going to wear their joints a lot faster, and athletically they will not be nearly as effective. So my goal physically for my patients is to help them move smoothly and efficiently through gravity, biomechanically efficiently. That's very important. That helps change so many things performance-wise and health-wise. But that same person, if I speed the energy up a little bit faster, we have an energy body. And this energy body, the two main ways that I look at it is the vortexes of energy and the pathways of energy. The vortexes of energy is what the Indian culture of Ayurvedic medicine says is your chakras. These vortexes of energy, you might have learned in yoga, there's 7 of them. They're right along the center line, right where our brain and our spinal cord is at. It's also where the endocrine glands are at. There's 7 endocrine glands and 7 chakras. They're right next to each other. So the endocrine glands are directly impacted by the chakras. And so the endocrine system is our hormonal energy. These chemical messengers allow us to communicate and perform vital functions in our body. And many people have endocrine issues. That's directly affected by the chakras. And the chakras not only affect the physical body, they affect the mental body, the emotional body. It's at multiple levels, the spiritual body. And then there's pathways of energy. In acupuncture or shiatsu, there's pathways of energy. And these connect to organs like an auxiliary nervous system. And unlike the normal nervous system where you might be able to just operate on it or chemically affect it, like a dimmer switch, I can adjust how much energy is flowing through my patient's bodies by adjusting the flow of energy, which is really great. And it affects all sorts of stuff. Like, for example, phantom limb pain. You know, if somebody's missing a limb and they're still having pain or sensations in the missing part, well, the surgeon's done the best job that they can do. They sewed everything up, but the person's still feeling something. Well, they still have an energy leg down there, even though the physical flesh is gone. I've done acupuncture when I've stimulated points with acupuncture, they're feeling their invisible part. It makes a believer out of skeptics real quickly, including the doctor, because there's an invisible part of us that we can't see. And then if we move the frequency up a little bit faster, now we come up to the mind, the realm of the mind and the spirit. And while they're not solid, we know the mind has a direct influence on the effect of the body. And if people have, stinking thinking, or they have trouble focusing on, or they got, mental issues that they're still holding on to, or emotional baggage that they've carried from the past, this is dragging us down. Same thing spiritually. We can have things we're not resolving. Do we love ourselves? Do we feel like we're worthy? These kind of things. Intellectually, a lot of us are aware of it, but it's at a deeper level that we may not have fully resolved these issues. So we're complex. Most of us have issues on more than one level. So whenever I can, I like to use more than one modality on my patients. Some people come in, I do massage and acupuncture, or I do acupuncture and Reiki. I like to mix things up because, again, if I can do more than one modality to achieve more than one frequency change, we're going to get better results. And if the patient realizes that the Hippocratic Oath that all doctors are supposed to take, that first do no harm, it's a great idea for doctors to not do any harm. But what I like to remind my patients is the patient should also take that same policy. If we have a patient equation where the patient's on this end and everything about them eventually creates symptoms and then come to the doctor end, if something on the patient end is being done by them or not being done by them that's leading to symptoms that I'm supposed to be resolving, one of us needs to let the patient know that if we work as a team, we're going to get a lot better results than if they just come to me and ask me to fix them, which I'm happy to try. But we're going to try and get better results if we're working as a team. So I can talk about this all day, but if you're interested in learning how energy medicine can help you, please give me a call. Thank you very much.